Sirio is a medical device generating low-frequency ultrasound to treat musculoskeletal pathologies. The device is supplied with 2 hand probes. The flat hand probe is to treat muscle pathologies such as contractures, distortions, hematomas, edemas, injuries, tendinopathy and meniscopathy. The concave hand probe is to treat joint pathologies of the shoulders, knees, ankles and bone and tendon calcifications. The recommended length for each treatment is 20 minutes. It is possible to have several treatments to get the desired result, and they can be done every other day if necessary. However, it is recommended not to have more than 10 to 12 treatments in total. Each treatment is carried out with 2 hand probes. The first part of the treatment is carried out with a flat hand probe, and the second part with a concave hand probe. The hand probes should be treated with care and cleaned after every use with a disinfectant containing alcohol. Thanks to the low frequency employed, it is possible to simultaneously take advantage of the effects due to mechanical vibration, diathermy and cavitation for physiotherapy treatments. The device features a refined ergonomic design. It was designed and is produced completely in Italy. It is a Class 2B device according to 9342 CEE directive and the notified body recognised by the Ministry of Health. The on-off switch is behind the touch screen. When the device is turned on, the LCD touchscreen display will show a check mark, which will need to be pressed in order to proceed to the password page. If it has not been modified, the default password is 1234. Press OK to proceed. On the next page, there are 2 buttons, Start and Setting. If nothing is selected, you will proceed to the treatment program page. In order to start the treatment, it is necessary to select the hand probe you wish to use first. During this check, the device verifies the hand probe's conditions and enables its use. Press on the check mark to proceed to the treatment phase. The device also performs a self-recognition check for the connected hand probe. Hand probes must always be clean and must be inside their housings during the self-calibration phase. As you can see, we've simulated some types of failures. In any case, the device prompts the user to repeat the self-calibration phase. When treatment starts, the default factory ultrasound power output is set to 40%. Let's see the procedure to treat all muscle pathologies. For instance, lumbar sciatica, muscle contractures and injuries, hematomas, edemas and muscle reactivation. Let's see the treatment of the Achilles tendon for lumbar sciatica. In order to achieve optimal treatments, it is necessary to use a supplied gel, which is specific for treatments with ultrasound devices. The gel's formula was studied specifically for these types of treatments and features active principles for soothing action. Gel must be used repeatedly during treatment so that the hand probe slides properly onto the skin and guarantees optimal transmission of the ultrasound through the skin. Press the on button and put the hand probe on the area to be treated, applying some pressure, and slide the hand probe with linear movements without stopping. The hand probe must slide on the entire area to be treated, focusing on the inflamed area, but also treating the surrounding areas. After the first 2 minutes of treatment, increase the power output by 10%. In order to find the best power output setting, it is necessary to ask about the patient's sensations. The patient must feel diffused heat on the treated area, followed in some cases by a tingling sensation. Increase power output in 5% increments every 30 seconds until you reach the best power output setting. If, during treatment, the patient complains about pain or too much heat, Decrease the power output by 5%. When treatment is completed, carefully clean the hand probe. The following procedure is to treat all knee joint pathologies. For instance, knee effusions, meniscopathy, cruciate and ligament inflammation. Calibrate the flat hand probe and confirm. Set treatment time to 15 minutes. Spread the gel on the area to be treated and press on. Put the hand probe on the area to be treated, applying some pressure, and slide the hand probe with linear movements without stopping. The hand probe must slide on the entire area to be treated, focusing on the inflamed area, but also treating the surrounding areas. During treatment, ask the patient about their sensations and proceed adjusting power output accordingly, as previously described. Calibrate the concave hand probe and confirm. Set treatment time to 5 minutes. Set power output at about 10% less than what was set for the flat hand probe. Spread the gel on the area to be treated. Put the hand probe on the knee and slide the hand probe with circular movements. Apply enough pressure so that the concave surface of the hand probe comes in contact fully with the surface to treat. When treatment is completed, carefully clean the hand probe. Back Medical Technology. Made in Italy.